Welcome to TelehealthFX Talk. Today, we are doing an episode that is long overdue. If you look at the GLP-1 conversation online, in ads, on social media, it's overwhelmingly targeted at women, and that has created this perception that weight loss medications are a women's thing. But here's the reality. The health risks of obesity hit men incredibly hard in some of the most critical areas of male health: heart disease, testosterone, sexual function, and sleep. And men are the fastest growing segment of GLP-1 adoption right now. So today, we're talking directly to the guys. Why GLP-1 medications work for men, the male-specific health benefits of weight loss, and why telehealth removes the barriers that have kept men from getting help. If you've been thinking about it but haven't taken the step, visit TelehealthFX.com. That's TelehealthFX.com. Private, clinical, no judgment from your couch.
I think the biggest misconception is that weight loss medications are somehow cosmetic or superficial. For men, treating obesity is one of the most impactful things you can do for your cardiovascular system, your hormonal health, your energy, your performance, and honestly, your longevity. So let's talk about what obesity actually does to men's health with specific numbers, because the data is staggering.
Let's start with heart disease, because this is where the stakes are highest. According to the American Heart Association, the age-adjusted death rate from obesity-related heart disease in men in the United States increased by 243% between 1999 and 2020. That's not a typo, 243%. For men under 65, having obesity for 10 or more years increases the risk of heart attack and stroke by 25 to 60%. And for every 1-point increase in BMI, the risk of heart failure goes up by about 5%.
Now let's talk about something that gets men's attention very quickly: testosterone. Here's what most guys don't know. Your belly fat is actively lowering your testosterone. Visceral fat, the deep abdominal fat that men disproportionately carry, contains an enzyme called aromatase. Aromatase converts testosterone into estrogen. So the more belly fat you have, the more of your testosterone is literally being converted into estrogen inside your body.
And the numbers on this are alarming. For every 1-point increase in BMI, men can experience approximately a 2% decrease in testosterone levels. A 4-inch increase in waist circumference is linked to a 75% increased risk of low testosterone, and up to 40% of men with obesity experience testosterone deficiency. Low testosterone means fatigue, decreased muscle mass, depression, reduced motivation, lower libido. A lot of guys are dealing with these symptoms and blaming age, when the real driver is visceral fat.
Which leads directly to erectile dysfunction. And I know this isn't something guys love talking about publicly, but it's too important to skip. Obesity causes something called endothelial dysfunction, which means the lining of your blood vessels gets damaged. That impairs blood flow throughout your body, including where it matters most. Research shows that obese men have a 30 to 90% increased risk of ED compared to normal weight men. One study found that 79% of men presenting with ED had a BMI of 25 or higher, and men with a 42-inch waist are approximately twice as likely to develop ED as men with a 32-inch waist. Here's the thing. ED isn't just a bedroom issue. It's often one of the earliest warning signs of cardiovascular disease. The same vascular damage that causes ED causes heart attacks.
And then there's sleep apnea. Obesity is the strongest reversible risk factor for obstructive sleep apnea. About 74% of adults with obesity have some form of it. A 10% increase in body weight is associated with a 6-fold increase in the risk of moderate to severe sleep apnea. If you're snoring heavily, waking up exhausted, and struggling to focus during the day, your weight could be literally choking you while you sleep. Sleep apnea worsens fatigue, kills your concentration, and further increases cardiovascular risk. So when you look at heart disease, testosterone, erectile dysfunction, and sleep apnea together, you're looking at a cascade of health problems that all share one root cause: excess visceral fat. And this is exactly what GLP-1 medications are exceptionally good at targeting. These medications are particularly effective at reducing visceral abdominal fat, which is the type of fat men disproportionately carry. And when that visceral fat comes off, the downstream effects for men are remarkable. Less visceral fat means less aromatase activity, which means your body stops converting as much testosterone into estrogen. Testosterone levels can recover naturally. Men losing significant weight on GLP-1 often report improved energy, better mood, higher motivation, and improved libido. This isn't testosterone replacement therapy. It's addressing one of the root causes of low testosterone.
Weight loss also improves endothelial function, which means better blood flow, reduced inflammation, better vascular health. Many men report improvement in erectile function as a secondary benefit of their GLP-1 weight loss. And for sleep apnea, losing weight directly reduces the neck and abdominal fat that compresses your airway. Many patients significantly reduce or even eliminate their dependence on a CPAP machine after substantial weight loss.
And cardiovascular protection is probably the biggest one. Semaglutide has documented cardiovascular risk reduction benefits. It addresses blood pressure, cholesterol, and insulin resistance. Given that obesity-related heart disease deaths in men have gone up 243%, this is potentially life-saving.
Now let's talk about why telehealth specifically works for men. There's research showing that men are less likely to visit a doctor, less likely to bring up weight concerns, and less likely to ask for help with something they feel they should be able to handle on their own. Telehealth removes those barriers. There's no waiting room, no face-to-face weigh-in, no awkward conversation in a clinic. It's private, it's convenient, and it's done from home on your own schedule.
And this is why TelehealthFX is such a good fit for men. Everything is handled privately. You get 24-hour provider review by real licensed clinicians who evaluate your full health picture, not just your weight. One-on-one onboarding, they offer Semaglutide, Tirzepatide, NAD+ therapy for energy and recovery, and Sermorelin for lean mass support. All with transparent pricing, no hidden membership fees, 2-day UPS shipping, licensed in all 50 states. Visit TelehealthFX.com. That's TelehealthFX.com. Private, clinical, no judgment, from your couch. I want to say this directly to any man listening. Taking action on your weight isn't weakness. It's one of the most strategic health decisions you can make. You're protecting your heart, your hormones, your performance, and your longevity. Every major men's health metric improves when visceral fat goes down. Well said. If you're ready to take that step privately and with real clinical support, visit TelehealthFX.com. That's TelehealthFX.com. Take the free qualification quiz, connect with a licensed provider, and start making the numbers work in your favor. Transparent pricing, no hidden fees, no judgment. That's TelehealthFX.com. And as always, everything on TelehealthFX Talk is for educational purposes only. This is not medical advice. If you are experiencing symptoms of low testosterone, erectile dysfunction, or sleep apnea, please consult your healthcare provider for proper evaluation and diagnosis. Individual results vary. Thanks for listening. Send this episode to the men in your life who need to hear it. We'll see you next time on TelehealthFX Talk.